Thank you for tuning in to Arirang TV's special coverage of COVID-19. I'm Min Sun-hee. Starting today, health authorities are going to be using remdesivir, the anti-Ebola drug, to treat critically ill COVID-19 patients. Also starting on this Wednesday, high-risk facilities, including bars and singing rooms, will face fines if they fail to make use of the QR code. We start the program now with our Kwon So-ah and Hong Yu. Right, let's begin with the latest updates on the pandemic here in Korea and elsewhere around the world with our So-ah who is standing by. So-ah, start us off with the domestic updates.
Hi, Sunny. Well, it's the 1st of July and it's been around half a year now since the outbreak here in Korea. And that's why health authorities this morning mentioned how much people had to give up due to social distancing. But of course, containment efforts were not in vain. And that is why we here in Korea can live our daily lives while abiding by the so-called day-to-day quarantine measures. But that, of course, only if the numbers remain low. Let's take a look at the numbers here. The 1st of July did kick off with some concerns because we have 51 new cases, bringing the total to 12,850. What's good news is that the death toll remains at 282 for the 6th consecutive day. Meanwhile, 955 people are still in quarantine and 11,613 people have fully recovered, with 76 more people discharged from hospitals. And now we are going to take a look at the recent developments of daily increases. We have 51, as I said again, and that's 9 more compared to Monday and Tuesday. I just want to make a note that the government made a correction for the caseload on Tuesday from 43 to 42. And compared to last Wednesday, we have the same number at 51. And let's move over to our map now. Gyeonggi-do province had the highest amount of new cases here with 16 cases. And with Incheon and Seoul combined, the metropolitan region has 27 new cases. And we have, of course, more scattered infections across the country, with a big concern down in Gwangju, which added 12 new cases. And now let's move over to the international updates. We have now almost 10.6 million total cases. We're around 15,000 short of 10.6, and the death toll is at 513,913 as of 12 p.m. Korea time, while almost 5.8 million people have fully recovered. And now moving on to severely affected places around the world. The U.S. has surpassed 2.7 million cases in total and also surpassed 130,000 fatalities. And Brazil went from 1.37 yesterday to 1.4 and has almost 60,000 cases. And another concern here in India, which added 18,000 cases, bringing the total to almost 586,000. So India could soon surpass Russia's total cases. Let's move over to other places around the world. Here we have 6 countries that all have exceeded 200,000 cases. And the biggest concern here is Mexico, which had 5,400 new cases in a day. That brings the total to 226,089. And those are the updates I have for now, but I'll be back after the government briefing later. Back to you, Sunny.
All right, so thank you for that. I'll see you back at the desk after the briefing. Right, while South Korea continues to combat COVID-19, North Korea continues to claim it is COVID-free. For more on the situation up north, we have our North Korea correspondent Hong Yu here in the studio. Welcome, Yu. Now, despite claims of being COVID-free, North Korea is nonetheless taking precautionary measures against the global pandemic, right?
Sunny, that's right. As you've just said, the official number of COVID-19 cases in North Korea stands at 0. The WHO's latest report on COVID-19 cases show that there hasn't been an outbreak in North Korea yet. Nonetheless, the regime is taking disinfection measures as schools have resumed early this month. International organizations have been helping this process, such as the International Federation of Red Cross, that mobilized 12,000 volunteers for the past 2 weeks to carry out diverse health-related activities. By health-related activities, they mean monitoring people with symptoms and disinfecting places to prevent the spread of COVID-19. The volunteers also distributed chlorine to schools and nursing homes so they can disinfect surfaces touched frequently by people.
Right. I hear authorities up north have also opted for virtual conferences.
Yes, North Korea held a preliminary meeting of the Central Military Commission last Tuesday virtually for the first time ever. And also the reports from North Korean news outlets last Friday show that a cabinet meeting was held via a video conference as well. The spokesperson of the Unification Ministry said that it is uncommon for North Korean leader Kim Jong-un to hold a meeting virtually. An official from the ministry also told me that the regime is avoiding events where many people are together, such as celebrations for the former North Korean leaders Kim Il-sung and Kim Jong-il's birthday this year, as part of his efforts to practice social distancing. Not only have they hosted meetings virtually, but also the opening ceremony for the beginning of school. When kids went back to school this month, they watched speeches prepared by their school principals on TV in their classroom instead of gathering all together at the gym. So Pyongyang's claim to have 0 cases of COVID-19 is up for debate, as there's no way to know for sure given the secretive nature of the regime.
Right. Now, in the early stages of the pandemic, North Korea took very quick action, that is, by shutting down its border with China. But in recent days, the number of trucks moving between the North Korea and China border, Chinese border, that is, has visibly increased. Do tell us more.
Some satellite photos taken by Planet Labs, a Earth imaging company, in late May show that trucks are moving to and from North Korea to China in the border Chinese city of Tandong. And such movements continue to be captured until last week. The spot where the truck had been spotted had been completely empty when North Korea had kept their border shut. 38 North, a website devoted to analysis about North Korea, also released some high-quality satellite photos of Tandong last Tuesday, in which trucks are seen lined up to cross a bridge towards North Korea, trucks crossing the bridge, and the same from the North Korean side. The amount of trade between North Korea and China have more than doubled for the month of May compared to April. Data released by the General Administration of Customs of the People's Republic of China last Friday showed that Pyongyang's food import had increased on month in May. In May, North Korea imported a total of 29,130 tons of flour, which is 6 times bigger than in April.
North Korea has opened up its borders to its traditional allies, such as China. South Korea remains on the outside looking in. How has the pandemic affected cross-border ties?
The Inter-Korean Joint Liaison Office in Kaesong, which was blown out by North Korea in June 16, was emptied before it was destroyed because the North has asked the South that they should have minimum contact between each other to prevent the spread of COVID-19. South Korea accepted the proposal and recalled its officers on January 30 from the Kaesong Liaison Office, continuing their daily phone calls as scheduled, but just in a different location, Seoul. However, no meaningful exchanges took place during those calls, with the two sides checking if the hotline is working normally and then hanging up. But even those 2 daily calls have stopped after the demolition of the liaison office by North Korea. Also, South Korea had planned to host the 20th anniversary of the June 15 joint declaration, but those plans have been scrapped due to the continuing spread of COVID-19.
All right, thank you for the coverage of the situation up north with regard to COVID-19. I'll see you again soon.
My pleasure.
Right, we are poised now to join the regular afternoon briefing on COVID-19 here in Korea. Offline sales of the thinner, more breathable masks are now taking place at convenience stores, supermarkets, and even department stores. These masks are believed to be more comfortable given the sweltering summer here in the country, thanks to, that is compared to the KF94, KF80 tight-fitting masks. Also, in related news, the government is poised to extend its crackdown on face mask hoarders through the month of September as sporadic cluster infections continue to challenge containment efforts. Now, those found violating, that is, may face a jail term of up to 2 years or a fine of up to 50 million won. And speaking of fines, as mentioned at the start of the program, violators of the QR code registration system starting this Wednesday will also be fined should they violate that rule, that is. And the health officials are also contemplating the designation of singing rooms and bars. Well, they have actually designated them as high-risk facilities. I meant to say that they're contemplating designating churches as high-risk facilities, given the recent rise in cases linked to these places of worship. Meanwhile, officials have also been unable to trace the sources of 11.8% of the new cases that have been confirmed during the period from mid-June to the end of June, raising much alarm over the presence of asymptomatic patients. We are still waiting for that briefing to start, and while we do, perhaps we can take a look at the numbers for this Wednesday again here in Korea. We have 51 cases on this Wednesday, raising our total number of infections to 12,850. The death toll remains unchanged at 282. We have 955 people still in quarantine, and a total of 11,613 people have fully recovered from COVID-19 here in Korea. Now, perhaps we can also take a look at the everyday quarantine measures that have been recommended here in the country. The first would be to stay at home if you find yourself feeling sick for at least 3 or 4 days. And also, should you suspect that you may have been exposed to the virus, do get yourself tested, especially if you live in the metropolitan area, including Seoul, where the testing is free. Also, stay 2 arms length away from others, and do wash your hands for at least 30 seconds and cough into your sleeves. Now, experts have also said instead of using sanitizers, washing your hands may be the best way to keep the virus at bay. Remember to ventilate at least twice a day and to disinfect regularly. Also, in the case of using air conditioners this summer, remember to ventilate your place at least once every 2 hours to keep the air fresh and safe for those who are indoors. Also, do be emotionally supportive to family and friends. You are being asked to keep your distance physically, not to keep you apart emotionally from those around you. Now, the briefing has yet to start, so what we will do is we will bring you this studio session first, and should the briefing start while we are talking, we will interrupt our discussion to go back to the briefing and then return to our studio. Now, Korea's strategic response to COVID-19 was made possible largely... excuse me, we'll take a look at the video first before starting the studio session. Korea's strategic response to COVID-19 was made possible largely by the commitment and care of those in the country's medical sector. And now these health experts are seeking to share their experience in tackling COVID-19 with their counterparts worldwide. For more on this endeavor, I have Director Kim Mangu of the ODA Center at the Yonsei Institute for Global Health. Welcome to the studio.
Thank you.
Right. I understand Korean medical workers offered non-face-to-face COVID-19 response training to some 100 countries across the globe. Do tell us more about this initiative.
Yeah, sure. COVID-19 has spread to all the continents, and developing countries are not an exception. So they are facing more problems because they have limited resources, and they must be more difficult than our country. So Yonsei University Health System and Korean government made video materials that's dealing with many issues about COVID-19. And these modules compose of 7, and it deals with simple issues such as hand hygiene, but all through the more...
Director Kim, I'll have to interrupt you. I'm really sorry. We have the briefing starting for COVID-19 by the government. I'll come back to you after the briefing.
Sure.
Right, here is the briefing. We'll come back to you with Kwon So afterwards.
As of July 1st, we have 36 new local infections and 15 new imported cases. And the total number of confirmed cases now stands at 12,850. Yesterday, 76 more people have been discharged, and a total of 955 people are in quarantine undergoing treatment. Yesterday, we had no additional fatality, and the death toll stands at 282. Fatality rate stands at 2.19%. And here are some updates on the domestic infections. At an apartment complex in Gyeonggi-do Province Uijeongbu City, we have found that there were infections, and we are conducting the contact tracing and the testings for about 240 residents there. And at the Gwangju Gwangnuksa Temple, we have a total of 19 confirmed cases as of now. And there were visitors accounting to 12 people of them. And related to Kumyang building, which is in door-to-door sales, there are 6 people. And also there is an encrypted coin briefing session, another 6 people there. And in Chungbu Okcheon, there was a car session, information session, and we have 2 elementary school students being confirmed, and a total of 11 have been confirmed to date. And contact tracing is currently being undergoing. And here are some updates on the imported cases. We have 15 new imported cases, 1 from America, and 14 from Asia, excluding China, 8 from Kazakhstan, 3 from Iraq, and 1 from the Philippines. The KCC is acknowledging the fact that we have found a large-scale cluster infection at a Russian flagged ship that has embarked on the Busan Kamcheon port, and we have our plans to intensify our port quarantine measures to this end. Starting from this week, today, we will be mandating the quarantine measures for all of the countries, not just including 5 countries, and these will also include all of the measures, including the possible infections of sailors, as well as the unloading personnel. And we will also carry out intensified on-board quarantine measures. And the port quarantine sites will be increased from 3 to 11 so that we can swiftly deal with the virus. And as for the unloading personnel workers, we will carry out diagnostic testings for all of them, and all of them will be mandated to a 14-day self-quarantine, and only when they are tested negative, they will be able to go out freely of the country. As for a temporary stay in of the sailors in South Korea, this will be minimized, and if they need to stay in South Korea temporarily, they will also be tested, and they will have to download the quarantine application. And when they unload and offload the belongings from the ships, we will carry out non-face-to-face contact, and all of the workers will require to wear face masks and abide strictly by quarantine measures going forward. The KCC also sees that the remdesivir, which is a treatment against COVID-19, and this will be administered to the patients starting from July 1st. And this comes in accordance to the Food and Drug Administration's decision to start the special imports. And to this end, the KCC has signed a special contract with the drug maker, Gilead Sciences. And the remdesivir will be administered to patients with severe conditions. And as for the conditions and criteria of the patients, will be also carried out by the National Public Health Center. And also, if there are medical centers that are in need of such a drug, then please apply for the drug by the Public National Health Insurance Institute, and we will continue our committee review, and you will also be administered by the drugs. And also we will continue to cooperate with Gilead Sciences to provide the drug here in the country going forward. And as we have suspicious cases of in-school transmissions, we ask the schools to abide strictly by quarantine measures. All of the students and faculty members need to screen their body temperatures. And please stay home if you have symptoms like fever or other respiratory symptoms. And all of you need to wear face masks at all times. And please wash your hands on a regular basis. And the students are also advised not to visit multi-use facilities, including singing rooms, PC rooms, and so forth. And also, when entering the classrooms, all of the students need to get body temperature tested. And also, if they have a body temperature over 37.5 degrees Celsius, they will need to be going home immediately. We are witnessing a global COVID-19 pandemic, and it is accelerating. And even in South Korea, we are witnessing cluster infections continuously, especially at enclosed, crowded, and close contact environments. And recently, we are seeing cluster infections in the metropolitan area, which has moved to Chungcheong area and now the Jeollanam-do province. And we are conducting our epidemiological investigations, but many of the sessions that have become the venue of the spread of the virus were intended to share information, and many of the visitors did not abide by quarantine measures, including wearing a face masks. And we also continue to highlight that these cluster infections these similar events are being also held throughout the nation. And through such information sessions, we have high risk of a possible widespread infection. And please do not go to any gatherings that do not abide by quarantine measures. And especially for those over the age of 65 who are especially in the high-risk group, please do not go to these activities and meetings. And for the family members, please also take good care of them so that they do not go to these meetings physically. And recently we have seen a suspicious case of in-school transmission. We are doing the epidemiological investigation. The results are yet to come. However, despite the difficult conditions, many schools and faculty members, as well as students, have put their endeavor so that we have been able to curb a widespread cluster infection on schools. However, the COVID-19 spreads through asymptomatic patients, and they can spread very fastly among people with no symptoms. So they can spread across the schools and private academies as well. And even if we have further cases of in-school transmission, we shall not blame these confirmed cases or these spreaders, and we ask the public to refrain from doing so going forward. However, please take this opportunity to take good care of your quarantine measures so that we can subdue the concerns of the patients as well as our young children. And also, the quarantine authorities will continue to conduct our epidemiological investigation. We will cooperate closely with the Education Ministry going forward. Thank you very much.
Right, that was Chung Young, the head of KCDC, with Wednesday's regular briefing. So, do give us a summary of the key announcements.
All right. Well, there has been a concern of spreads of the coronavirus at schools because a couple of students have been confirmed with the virus, but it's still being suspected whether these infections actually happened within the classroom. So there needs more contact tracing to be done. That's why Chung stressed that students and also other faculty members at schools should abide by the social distancing measures which the government laid out before. And also, it looks like the government will have stronger measures at ports, because recently we had that case from a Russian-flagged ship where a lot of people got infected, and that's why beginning today they will have onboard checks of some 54 high-risk countries, and also beginning on the Monday, every sailor getting off ships will be tested for the coronavirus, and also they will have to self-isolate for 14 days, or their facilities have to be checked for that amount of time. And also she mentioned how imported cases have been rising as well, as we have 36 local transmissions today, and the other 15 are imported cases from various countries. And especially looks like Kazakhstan has been a country where many entrants have been coming into Korea. So that's another concern.
All right, so thank you for that. We'll see you again tomorrow.
Thank you.
Right, well, we return back to our first studio session. I have Director Kim Mangu from the ODA Center at the Yonsei Institute for Global Health to talk to us about the efforts by medical experts here to share their experience in tackling COVID-19 with their counterparts across the world. Director Kim, as we were talking about this, Korean medical experts here, workers, offered non-face-to-face training, response training to COVID-19 to some 100 countries across the globe. Do tell us more about this initiative.
Sure. COVID-19 has spread to all the continents, and the developing countries are not an exception. So they're going to face more trouble because they have limited resources. And Yonsei University Health System and Korean government made a video materials that will deal with many issues related to COVID-19. The modules are composed of 7. It starts with personal protective equipments, but also to the more updated treatment for COVID-19. Since the COVID-19 test kits from Korea is delivered to more than 100 countries around the world, we're going to assign enough time about the diagnostic system and real-time PCR and result analysis.
I see. Now, given the differences that exist in lifestyles and health practices around the world, I'm sure a one-size-fits-all approach would have been quite difficult. What were perhaps the greatest challenges in producing or making this video?
Yeah. Well, nobody knows the whole picture of this disease, COVID-19. So we are experiencing it, and we are learning about it, and we are treating it, and we are making researching out of it. So it's happening all together at once. So Korea happens to be one of the first countries to have the outbreak. And well, our way is not the best one, but at least it might be helpful for other countries to deal with that. So we try to focus on common issues, which is regardless of the climate or the cultural background, it will be shared. So from our past experience, we learned that a very dynamic and quick collaboration between many departments are very important and play the key role. So we want to put an emphasis on this one.
I see. Yeah. What has the response been to your video? I'm very curious, especially in developing countries.
Yeah, it's just began, so we're not sure about it. But KOICA is monitoring the response from the countries using the Korean COVID-19 test kits. So we hope that this video materials will help them, and surely there should be some shortcomings. So we're going to have a Q&A session in the last module. And medical professionals can join and ask practical questions in that session. So there's no charge, and it will be uploaded in YouTube, but also in the Facebook, because the internet connection will be not so good, so they can join that. And after the 12th of August, all the video materials will be posted on KOICA COVID-19 Information Hub. That would be a website. And the medical professionals can register through a local KOICA office, and they're going to have a pre-test, post-test. And if they finish all the modules, they're going to have a certificate. I'll just bring an example of the certificate. So it's going to be delivered to the persons who finish that program.
Oh, I see. That is good to know. Director Kim, are there any other initiatives that you've planned to better assist healthcare workers?
Yeah. Well, if we have a specific drug or vaccination, the situation will improve, definitely. But we cannot just sit and wait for that to happen. So we have to keep on going with the current system of prevention and management, and update the information of COVID-19. Our hospital is reinforcing the facilities, and actually we have a task force team to deal with COVID-19, update the information, and teach the new issues about this one. And Koreans are very good in wearing masks and washing hands. So I believe that this might be one of the possible reasons that we have a better result fighting against COVID-19. So we must have to continue with that. Personally, I want to say that we have to know more about the high-risk people who is getting more sick when they are exposed to COVID-19. So we have to make some definitions and be more careful to prevent the infections spreading to that group. I think if you're more old, you have a risk, and if you're immune compromised or you have some diabetes, heavy drinker or smoker. Yeah.
Right. All right, Director Kim, all the best in your future endeavors, and thank you very much for making the time to join us here at the studio.
Thank you very much.
Right. Elsewhere around the world, Dubai is poised to open its borders to foreign tourists come July 7th. Now, it is a major tourist destination, having welcomed more than 16 million tourists last year alone. For more on the efforts there to revive the economy and reinstall a sense of normality, I have Rebecca Proctor, a reporter that is, for Arab News. Hello, Rebecca.
Hi, how are you?
Fine, thank you, Rebecca. Let's begin with Dubai's decision to lift travel restrictions. Do give us some background behind this move.
So this has really been exciting news for Dubai, given that Dubai's open economy relies on trade, tourism, transportation, and retail. And it was really hit hard, not just by the Emirates' 24-hour curfew at the height of the crisis in April, but also the spectacular collapse of crude oil prices caused by the price war and a lack of demand. And as a result, finance ministers across the oil Gulf rich have drastically cut spending. So that's been quite difficult. But it's also crucial to note that the tourism industry in Dubai has the highest share as GDP contribution to the economy of its country amongst all Gulf Cooperation Council states. In the broader context of tourism GDP contribution for the entire Middle East and Africa continent, Dubai is second only to Marrakesh. So in late April, we were in a very stringent lockdown, 24-hour lockdown, and the Dubai Chamber of Commerce surveyed 1,228 CEOs across a range of sectors, and they concluded that around 70% of Dubai companies were expected actually to go out of business within 6 months. And so it's been really vital to upstart the Dubai economy, to open the borders, to get tourists here, because obviously tourism is so crucial for really the health of Dubai, of the Dubai economy. So we've, in some ways, reopened before many other nations around the world. Yeah.
Rebecca, staying with the opening of its borders, what measures are being adopted by officials there to ensure public health and safety amid plans to lift its travel restrictions?
So there's still, much trepidation and unease in the air surrounding the coronavirus, but we are all, it's all mandatory for us to wear a face mask when we go out. If we don't wear a face mask, we have to pay very hefty fines. There are temperature checks at every single outlet, every single restaurant. And, if the temperature is too high, sometimes it's too high also because of the heat. It's very hot now here. We have to take the test again, or you have to go to a doctor immediately. It was recently announced also for Abu Dhabi, the neighboring emirate, that we have to all, actually Dubai residents or any other resident coming from another emirate needs to show a negative COVID test before they enter Abu Dhabi. And then, of course, flying now. So you can fly. The borders are open, but there are very stringent measures. So we actually have to present a COVID-19 negative test. Foreigners do before they enter Dubai, and then if we are to leave Dubai, we actually have to ask for permission. We have to apply to come back to the Emirates, and again prove that we are show that we have a negative test. So there actually are tests conducted at the airport. So that's doing, we're open. Dubai is open, but there are obviously very specific measures being taken to ensure health and safety. Another important aspect is the national sterilization program, and that was taking place every day from 11 p.m. to 6 a.m., which meant that Dubai was cleaned every day until last Thursday. The curfew dropped, but so there's a lot that's happening on the ground.
I see, Rebecca. All right, Rebecca, thank you for being with us live at this hour to share your thoughts.
Thank you.
Cases of COVID-19 continue to climb in countries across the globe despite the commitment of healthcare workers to contain the contagion. Now, amid the widespread speculation of a second wave, many are calling for greater global effort to deal with this pandemic. For more on this, I have Ambassador Michael Reiterer from the European Union. Welcome, Ambassador.
Thank you.
And I also have Professor Kim Hyun-wook from the Korea National Diplomatic Academy. Hello, Professor.
Thank you.
Ambassador, starting today, that is July 1st, EU member states are opening their external borders to non-member travelers, granting them quarantine-free access. Do tell us a bit about the background behind this move.
Well, we started first within the European Union in order to get rid of limitations. And that has, against the background of social distancing, against the background of taking all the measures which are necessary. But we have come to the conclusion that in order to start a normal life, we are very attached to the freedom of traveling, to working, studying. And we have come to the conclusion we can do it within the European Union, and we have decided now from today onwards as a recommendation that member states may lift the temporary restrictions for non-essential traveling, as it is called, holidays, leisure, whatever. Now we have a list of 14 plus 1 countries, and member states can now take the decision according to which plan they want to liberalize the traveling and which measures they want to adopt or maintain, if any. But in having this decision yesterday, we want to make sure that we have a system within the European Union which is comparable, but the direction is clear, it is opening.
Ambassador, you spoke about 14 countries being offered the opportunity to travel into the EU. What is the criteria upon which the list of the 14 countries was drawn up? Because I understand Korea, fortunately, has been included. The US has been excluded.
Well, the criteria are clearly health-related. We are talking about a health crisis. We are not talking about a political crisis. Therefore, we have taken the decision that we apply, and I have to quote that because it's a little bit complicated, the number of new COVID-19 cases over the last 14 days per 100,000 inhabitants close to or below the EU average, as it stood on the 15th of June. Just to give you an idea, we have now 14 to 100,000. So this is a measure, and we will look at all the countries and we will review the list every 2 weeks. And if they meet this criteria, as well as a stable trend, a decreasing trend, that countries have an overall strong reply and consistent measures against COVID, and we also have the element of reciprocity. If you put these 4 elements together, these are the criteria based on which member states can take the decision to open up gradually with these 14 countries. It's their decision, and the 15th country is the one which we say with the asterisk, it's China, but there we insist also on the principle of reciprocity.
I see. Professor Kim, speaking from an academic point of view, how do you assess the impact of COVID-19 on politics and diplomacy?
Well, actually, Ambassador is also has a background of academics, so I think he knows better than me. But I think there is a very big impact on the international politics. The first thing I would say is that I think this is the biggest impact of non-traditional security threats on the United States, which is a hegemonic state. I think after the end of Cold War, we can think of 3 major non-security threats. First one is September 11th terrorist attack, which has been a non-traditional security threat to the United States. The second one, I think, was the global financial crisis in 2008, which also had an impact on the decline of the United States hegemony. And this is the third one. And this third one, I think, is the biggest impact on the United States. Second impact, I think, would say that there were some decline of globalization because of coronavirus. Even after coronavirus phase is down, I think many countries would be thinking of the countries, more authority to deal with all these threats to protect their people. And maybe last one, I think, would be the escalation of the U.S.-China competition. Those countries after coronavirus, I think the gap between these countries would be decreased, and the competition, I think, will be much more serious.
Right. Ambassador, President Moon Jae-in and leaders of the European Commission and the European Council held virtual talks yesterday. There was a conference there to reaffirm their ties and commitment to work together, of course, especially in light of the pandemic. What significance does this exchange hold, given the current circumstances?
Well, I think you have to see the context. The leaders who met virtually yesterday and committed to meet in person as soon as possible also commemorated 10 years of strategic partnership between the European Union and the Republic of Korea. And we have only 10 partnerships worldwide, so we are not using lightly this expression. So for us, Korea is a very special partner. We have 3 fundamental agreements, including a free trade agreement, a political agreement, and a security agreement. And therefore, we have a wider approach in our relationship and in our discussions. And that's also necessary. Just take the context of the crisis. What was discussed yesterday was, it is also a chance for the reform of the economy. We spend so much money, trillions of euro, dollars will be spent, so we have to spend them smartly, intelligently. Green Deal, European Green Deal, Korean Green Deal. That was a very important issue, because if we spend the money, we should not invest in dark economy, in green economy. We should invest in the digital economy. And this willingness to work together was confirmed. And there it is also part of our partnership, and President Moon Jae-in has confirmed it. We believe in multilateral solutions. As you mentioned, in this crisis, there is a sort of reaction, everybody isolating, I do it for myself. This is completely wrong. This is like if there's an earthquake, if you run out of the building. Everybody knows you shouldn't run out of the building, something falls onto your head. So we have to overcome this reflex, and we will work together in the development of vaccines. And we made the commitment that once a vaccine is developed, that should be the property of mankind and should not be reserved for a privileged class. I think a very important multilateral commitment.
Of course. Professor Kim, earlier this month, President Moon Jae-in also accepted the invitation to the Group of 7 summit slated for September this year, I believe, by US President Donald Trump. What significance does this invitation hold, do you think?
I think this is a very important opportunity for South Korea to be in the leaders group. Well, in fact, the G7 has begun to deal with the oil shock in the 1970s and expanded its agenda afterwards to security affairs. But at this time, the meaning of extension of G7 to maybe G10 or G11, I think would be that the agenda, major agenda, would be changing from the global economic issues to a more Asia issues. I think some countries would be added would be like South Korea, India, Australia, something like that, which I think is very much linked to the US policy of Indo-Pacific and also economic prosperity network aiming at and targeting at China. So I think the major goal from the US perspective, expanding G7 to G10 or 11, I think will be definitely targeting China. So I think this is very important opportunity for South Korea, but maybe have to aware of the fact that it's targeting China. So maybe some other agendas to deal with the economic recession after coronavirus, especially focused in Asian region, I think that will be something South Korea have to focus on more.
I see. So that's something we can work on then. All right, we're running out of time, which is why I'll have to end our discussion there. Professor, thank you for your thoughts, and Ambassador, thank you for being with us today.
Thank you.
Right, like I said, that ends our coverage for this Wednesday. Do tune in tomorrow at this hour as we delve into the repercussions of the pandemic on the global job market. In the meantime, Arirang TV welcomes your thoughts and inquiries through our social media accounts or our homepage, arirang.com. See you tomorrow.